Recovery from injuries. It is a common myth that everyone suffers long-term pain and disability following a collision. The facts are that although collisions are traumatic, most people fully recover from their tissue injuries. An acute diagnosis, hopeful patient expectations, early symptom relief, early joint motion, and getting back to normal activity are important in the successful treatment of traffic injuries. Differentiating incidental pathologies from new tissue damage pathologies is also important to prevent chronic pain. Acute pain is much different than chronic pain. Below are a few of the factors that are predictive that a patient may have a higher risk of developing chronic pain or slower recovery following a traffic collision. Initial pain levels of greater than 6 out of 10. Initial neck disability index scores of greater than 29%. Symptoms of post-traumatic stress. Pain catastrophization. PTSD. Recovery expectations. Depression and cold hyperalgesia. Qualified permanent impairments supported by the AMA Guides to the Evaluation of Permanent Impairment, 6th edition, are also indicators for possible prolonged dysfunction or pain.